It gives me a lot of pleasure to introduce Andrea Wary, who is the Vice President for Women's and Children's Institute at Geisinger Health System, speaking with us today. You're going to enjoy her story. When we think about this topic of fortitude, we often, get an image in our minds, I think, of somebody trying to be super strong or, through effort. And what Andrea shares with us helps us understand that as we live through really challenging circumstances in our families and lives, that in fact, the ability to stay through that and to learn from it and to develop is in fact what fortitude is. And fortitude is not just an individual characteristic, it's something that you can share with others, you can create as a leader in other situations. And so I'm just delighted for you to meet Andrea Wary.
Thanks, Doug. I think it's a pleasure to be here and happy to be chatting with all of you. As a little girl, I gazed out of my mother's hospital window to see one of the nation's first air ambulance programs. Pilots, physicians, and nurses literally saving people's lives. How could I imagine a little girl from rural Pennsylvania, 40 years later, would be capable enough, competent enough, or strong enough to lead these superhumans through the pandemic of a century? From womb to tomb, these are the rock stars of the clinical community, prepared to take on life and death situations with both clinical expertise and compassion in MacGyver-like ways. At the age of 8, I was living in a small coal mining town in rural Pennsylvania. It was endangered by a mine fire, endangering both the town and the residents. My sister recently married, my brother went off to college, and my mother was diagnosed with leukemia. She would spend nearly the next 3/4 of a year hospitalized. I remember seeing her for the first time after 2 months. She had likely lost about 1/3 of her body weight. It created a frail 5'7" frame that was nearly 100 pounds. It was shocking, and I can still see it vivid in my memory. She had told the providers that she would sign out against medical advice if they did not let her see me. They obliged. I still carry the guilt with me today, as I did not provide the welcome she was hoping for. I approached her with fear, as she was barely recognizable, and I can still see and hear her sobbing in response to my reaction. The next few years would be filled with my mother's hospitalizations, her death, and a father that struggled with major depression. He was often hospitalized. But still, I had a community of family and friends who gathered to support me. In many ways, these years defined the person that I would become. The leadership traits often identified as my keys to success were cultivated in this unfortunate environment. Each day, my father would identify a home of a family or friend that I should go to after I got off of the school bus. They would feed me, help me with homework, or just include me as a family member, sometimes going to church, on vacation, or just being sure that I had what I needed. My community was my extended family, and to this day, I have a unique relationship with each and every one of those people. While I would have preferred growing up with my mother, what I had is just different than others, a blessing in its own way. This experience created the collaborative, flexible, and autonomous, and authentically compassionate leader that I am. On Friday, March 13th, 2020, I was faced with a professional clinical challenge bigger than I had seen thus far. Geisinger Health System is 2 hours east of New York City. In the early days of COVID, the scenes from New York City were jarring and unbelievable, almost like a science fiction movie. The visions of Army disaster tents outside of hospitals, refrigerator trucks in plain sight for bodies that had succumbed to this unknown pathogen were out in the open. The call came from our chief medical officer: be prepared to accommodate something similar within days. The team's emergency management skill was highlighted as we methodically, like a well-oiled machine, put clinical pathways, facilities, and people into place. I was the incident commander for emergency medicine within 11 hospitals, an air ambulance fleet, and an EMS team. The best and the brightest, all rowing in the same direction. What emergency management didn't prepare us for was the raw emotion. Not only being there for patients, but for staff. In the early days, people died with nurses holding their hands in papper suits because family members could not be present to grieve. The emergency medicine staff was aware of the danger, but arrived every day saying, we're the best equipped to be the tip of the spear. The community which supported me through what I call as my unique childhood uniquely prepared me with the character and foundation of skill sets I now possess. The leader who facilitated organizing clinical pathways, operations, and human-to-human support during the pandemic of the century. I was keeping succession planning lists in the event that my professional colleagues succumb to this pathogen. Dr. Stroney, who's next in line in the event that you can't perform? I held this conversation more than 20 times with 20 different people. I recall one specific day, leaders asking to join our emergency management leadership huddle. I found myself leading a group of 125 leaders, being consulted for guidance and facilitating operations. The folks I was leading were the people I admired and I aspired to be. I was thrust into this place without any time to think, fear, or worry. Before I knew it, weeks and months had passed, and I emerged a stronger, more flexible, and a more confident leader. I found myself leading the rock stars outside of my mom's room. The people in the blue suits, whom I have always aspired to be clinically because they are the best of the best. Often folks will mention my sad or traumatic childhood. My sister just did it last week. I correct them. Well, I wish my mother was here. My experiences, my family, my community, which supported me, made me the leader that I am, the mother I am, and the friend that I am today. I'm uniquely me, and I'm proud of me. I'm grateful for my extended family, my community who took me in. It's an example of how a community can pull together to really bring out the best in someone, and I'm forever grateful. Thank you.